Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today's special guest, Tamara Seeger, talks with Morgan Hare about the Patient Advocacy Program and what you can do to help. And now, here's Morgan Hare.
Hi, this is Morgan Hare from MD Source. I'm here today with Tamara Seeger, who is the Director of Advocacy for the AiRS Foundation Alliance in Reconstructive Surgery. Welcome, Tamara.
Hi, Morgan. Thank you so much for having me.
Tamara, tell us about the Patient Advocacy Program.
The Patient Advocacy Program with the AiRS Foundation is really unique. It is a program that helps patients who have a desire to have breast reconstructive surgery that can't afford the procedure. The advocacy program really is a voice for patients that don't have other options. The advocacy program that I oversee, I recruit and train volunteers to work with patients that really have exhausted every other avenue for help.
Can you tell me what the primary goal is of the Patient Advocacy Program?
The advocacy program is really to support, advocate, educate, and support patients through the reconstruction process. Advocate is where we as advocates stand up for the patients, helping them navigate a really often confusing and complicated healthcare system. We also educate them on different options for breast reconstructive surgery, and we support them through the process.
So tell us, who are these women who come forth and want to be advocates?
Well, we have women all over the country. We're getting more and more advocates and volunteer interest than we have in the past. And really one thing is consistent. These are very compassionate people that simply want to help. Some of the advocates could be former breast cancer survivors. Others have been caregivers for family members that have went through the breast cancer surgery and reconstruction, and others really have no relation or have no experience with breast reconstruction, but they're just someone that sees that women need support, both physically, emotionally, going through this experience.
And what do they all have in common?
Really, all of the advocates have one thing in common, and that's just that they are compassionate individuals that clearly just want to help another person through a difficult time.
Is it very time consuming to be an advocate? How much time do I have to give if I'm an advocate?
Well, one of the great things about AiRS in general and the advocacy program is it's very flexible. People can give as much or as little time as they have available. We pair patients with an advocate, and I ask them if they're available at that time, and if they are, then they can take a patient on, and if they're not, then they can pass. It's really flexible because we understand that advocates have jobs and lives, and so it's really nice that people can volunteer from the comfort of their home.
And how do you choose which advocate is the right person for a patient?
Yeah, that's a great question. I have the opportunity to talk to the patients prior to pairing them with an advocate, and just learning enough about them through their history and what they've been through. I generally try to pair them with someone as much as possible in the same geographic area, so they have something in common, or if there are other commonalities, that I can pair them with someone that maybe has been through a similar type of cancer that they've had, or has a similar experience, so that they can bond.
So the AiRS Foundation has helped women in over 20 different states. Do you have to be in the same location to be an advocate as the patient, or can you be anywhere in the country?
Absolutely not. You can live anywhere in the United States and still advocate. Thankfully, with technology, most of our patients prefer to communicate by email, text, telephone, and really they're just looking for someone who can be there to listen to their concerns. Even people that have support from their families and friends, they sometimes just need someone from the outside that they can confide in, because this is very emotionally difficult process to go through a mastectomy and reconstruction. And so if you're in Florida, it's very easy. You can still advocate for someone that's in Ohio and vice versa.
So you don't have to be in the same location.
Absolutely not.
And is it important that the advocates have had breast cancer, or is it not that important?
Well, we do have a lot of advocates that have gone through breast cancer, and what I've found is that there's so many women that just have a wonderful heart that once they have had the experience, 1 in 8 women being diagnosed with breast cancer, so many now want to use their experience to give back. And so we're finding more and more survivors that want to use their experience to help others. And so just because they have had that experience does make them easy to relate to, but others have not had breast cancer at all. Now, there might be a little bit of a learning curve, learning the different types of breast reconstruction or some of the terminology, but it's not required that someone's had breast cancer or been a caregiver to someone that's had breast cancer. We have other advocates from other walks of life, all different type of backgrounds with their professional life or personal life. And that's what makes it great, because we have women, all of our patients are from different walks of life also.
So I understand that an advocate can be there as a support system, but they don't help you make decisions, and they don't make decisions for you. Is that correct?
That's correct. We certainly don't give medical advice. And so while many of our advocates have had personal experience, and sometimes they talk about that experience, they always leave the decision making up to the patient. We do believe that the best advocate at the end of the day for the patient is the patient themselves. So we don't make decisions, but we do give things to think about, maybe questions to ask, so that the patient can go back to their surgeon, ask good questions so that they can make decisions for themselves.
So that's really part of the educational process, isn't it?
Absolutely, yes.
And so why would someone want to volunteer then?
Well, the AiRS Foundation is truly unlike any other breast cancer organization, in my opinion. I believe it's revolutionary because it speaks to the emotional side of breast cancer and recovery. And while the cure is important, and those types of organizations that help with living expenses and different things, those are important, but a mastectomy is like an amputation, and many women that go through breast cancer are left feeling just empty, and their self-esteem is affected in many cases. And when I talk to patients and I learn one thing is in common with almost every person that applies to us is that they want to feel whole again. And for different women, that may mean a little bit different things, but we are doing something revolutionary because we're speaking to the emotional side of recovery. And it is so fulfilling and just an honor to deal with these women, because it really, to see their bravery and everything that these women have gone through, by the time women reach reconstruction, I've found that they are physically, emotionally, and financially depleted. They are completely depleted. It's difficult, and when they get to us, they really need somebody that can be compassionate and understand. And so really the only requirement for someone is to be compassionate and want to help.
So how do you train the volunteers?
The training is unique because, we are scattered across the United States. And like I said, it's a unique opportunity to volunteer because people can volunteer from the comfort of their own home, just connecting with other women that need help. So we do an online type go-to meeting. We do a phone call and a video that does an orientation, an overview to the AiRS Foundation as a whole, some of the things that we do aside from the advocacy program, but then more in depth with advocacy guidelines and what the kind of the do's and the don'ts, and making sure that information is kept confidential, things to say and not say. You mentioned not giving medical advice or not pushing our own beliefs on another person, but just being a compassionate listener. And so we do that all through technology.
So what's your expectation of an advocate?
Really, the main thing for the expectation with an advocate is just that they are compassionate, that they are willing to learn, learning about the different types of breast reconstruction, and that they're willing to just plug in and communicate what's going on with the patient, so that we can make sure that patients don't fall through the cracks. They've been through enough, and we want to make sure that if someone commits to being there for a patient, that they follow through. And if they can't, then we'll take care of that and handle it a different way or assign another volunteer. Things happen, but we just want to make sure that our patients are taken care of from start to finish.
So if I'd like to volunteer and be an advocate, how do I go about that?
Well, there are a couple of ways. The first thing is we do have a link on our website, which is airsfoundation.org. And there's a link to make a difference, and there's a short volunteer application. And when someone fills that out and submits it, then our team will get back with you and go through the orientation process. But we also have a link on volunteermatch.com, which provides some information. And either way, we have several methods of contact, and we're interested in always adding to our volunteer team. We're getting more and more applications from all over the country, and we need people to help support these women.
And how do I find out about the advocacy program if I don't go on our website? What are other means for people to know that we're out there?
Again, volunteermatch.com. If you're not online, our phone number is one method. Of course, there's information on our blog. We have information available.
So, but do people oftentimes read about us in the press or social media?
Yes, we have a for those that are connected on the internet. We have a Facebook page, Instagram, and we're connected through a lot of press. Actually, the last year we've been receiving a lot of press. We've had more advocates contact us that saw we were in, a magazine article or a news report. And so that is helping us to get the word out about AiRS.
Well, I think what you do is absolutely essential, and it's wonderful. And you're so much appreciated by all of the advocates and the patients who come our way and know that we've really helped somebody during a difficult time. So, Tamara, thank you for talking with us today.
Thank you so much.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.